morning. How's your weekend?
It was good.
So the first thing I do in the morning is I open my computer and I look at the schedule and I see who's here today. So my first patient of today is a follow-up. She got Botox in her frown lines, her forehead lines, her crow's feet with a little brow lift. She got a lip flip and then bunny lines. So let's see how she healed. Hi. Good to see you too. Your Botox results came out so good.
So good.
Cannot wait to show you photos.
Yeah, I want to see.
How do you feel? Good. Take a look at your photos. So let's go in a little closer. So this is your results from your forehead lines.
So much better.
So smooth.
Oh, they look so good.
And then frown
Oh my
lines.
gosh, look.
Isn't that crazy?
So good.
Yeah, I got it. And then before, after.
It looks great.
So pretty.
I
And then
can tell, totally.
and for brow lift, what we look at is you see how the tail end is yanking down with the muscle? It's no longer yanking, so it's just like flat and elevated, and same with this.
Perfect. Yeah.
So you have more eyelid space.
Definitely.
And then look at this lip flip.
It is so amazing, and I notice it.
Yeah.
I notice it when I'm smiling or taking
Right?
pictures. I feel so much better with it.
Let me take a look at you.
It looks so much better. It really
You look
does.
refreshed, for
Yeah,
sure.
I don't feel so haggard.
This smooth eyes are so funny here, right? That's for sure. First, have you get it down for me? Eyebrows look really high. Nice. And then start really cheesy. Squeeze. Perfect. And relax. And then wrinkle your nose for me. Perfect. Alright,
Awesome.
lovely. That's it. So we don't need to do any additional units today. I'll see you back in 3 months. I know last time we talked about a little bit of under eyes and smile lines. You
Yes.
can always come back before the 3 months if you wanted me to treat those.
Okay.
Let's actually go to the front together and get you on my schedule for
Okay.
3 months. So follow me.
I do want to, there was one, I can't remember what the treatment plan looked like. There was a few things that I wanted to see if we could do it sooner than
later. What I have is neckline, smile lines, or under eye with like a little mid cheek.
I think that that's what it was, this.
Is that right in the cheek?
Yeah. I
Perfect.
think so.
Let's find her a 30 or 45 minute appointment where we could do that.
Yeah.
And then a 3-month Botox retreatment.
You got it. Sounds good. Thank you so much.
I'll see you soon.
I'll see you soon. Thank you.
My next patient wants a lip line loose, so come on in, let's go see her. Good, how are you? Good, how are you? I'm good, thank you. Sounds like we're ready for a little more filler in that upper lip.
Yeah, we're doing
The lip line this time, right?
yeah.
Let's take a look together. I'm glad we're doing this because last time when we filled the vertical lip lines with Bobella, I love what it did for your lip.
Me too.
But I still think you just need a little definition. Obviously, we talked about that. That's why you're here. But you see how that little asymmetry we have on the upper right lip? You see how it's a little bit higher set, and this is a little lower. I see this all the time. It's natural asymmetry, but I'm gonna try my best to perk this guy up to match the other
Nice.
side. Yay! You're so cute. I can't wait. We were talking about her upper lip when she was in a few months ago, and we noticed a couple vertical lip lines, which we actually feel beautifully with Bobella. We also sprinkled a little neurotoxin to help relax those lines, but now we're ready for some definition in the upper lip border, also known as the vermilion border. We're just gonna give her a little more vertical height with that. We're gonna crisp up the cupid's bow, and it's just gonna give her more definition so lipstick can hang on to it better, which I really love for that, by the way.
Wow, look at lips.
Right? They're so cute. They're little swollen from all the injection sites, but they're gonna crisp up even more in the next week. Just nice and easy with those babies.
Nice.
Yeah, you're gonna love your lip liner now. It
I
has
know.
something to hang on to. It's like a little shelf.
Yeah,
You know?
yeah. So it doesn't just fade into the cracks.
Yeah, or bleed up.
Yeah.
That's
yeah.
like the worst part.
Super excited.
Yay!
All right.
Alright, I love you. Take care.
Bye.
Happy holidays.
You too.
My next patient of today, it's a first timer Botox, so let's get started. Hi Amanda, how are you?
Good, how are you?
Good, thank you. I'm Anisa, the nurse practitioner. So nice to meet you.
Nice to meet you.
The first time Botox?
I'm a little nervous.
Totally normal, as expected, but I'll walk you through everything so you know what to expect. Of course, you can take your mask off since we're in the room. And then was there a particular area that you were most interested in?
This.
Frown lines.
The frown lines and like up here.
Mm-hmm.
And I'm not sure, like when I smile, sometimes my eyes get really small.
A little bit.
And so I'm not sure if getting Botox there would help or if I'm too young, I don't know.
Yeah, no, never too young.
Okay.
Well, let me have you put your hair back if you don't
Yeah.
mind. And then let's look at your face together. So if you're open to it, I usually offer all my newbies like a full face assessment just to know what you're a good candidate for. It's like skincare includes filler, just so you know. But today we'll just focus on Botox in terms of the treatment. So let's look in the mirror together. I'll start at the forehead and work my way down to sorry about that, the chin area. First things first, let's address the frown lines because that's your #1 concern. Go ahead and get really angry for me as far as you can. Yeah, so you're really strong here, right? We're starting to notice some 11s. Go ahead and get really angry again. Yeah, 11s forming, a little crease on the nose. So let's get after that. I'm gonna recommend 30 units there, and that will fully relax the brows and just pick up the lids a little bit too.
Okay.
Raise your eyebrows up really high for me. So this is an area you don't have strong horizontal forehead lines. It's an area I also recommend skipping. Say so, honey, I don't think it's necessary, and given the eyelid and eyebrow position,
Yeah.
it might make you feel heavy, and that's only for you because of where you are anatomically. But my theory is we can always add on later. So start low and slow, and then we can always do that your follow-up if we need a little more. I don't want you to be too uncomfortable. Of course, I get it. Let's talk about around the eyes like you mentioned. So smile really cheesy with your cheeks. Yeah. It's harder. Good. 2, 4, 6, 8. So when we put Botox in the lower lid for these fine lines, what it does is it helps relax that little jelly roll is what we call it. Helps relax the lines, and indirectly it opens up the eye so you don't get squinty when you smile, if that's a concern for you. So I think you're gonna love that. I'm also gonna give you a little lateral brow lift where it just picks up the tail ends up. I think you'll like that only because with time, everything starts to descend. It's normal aging, and everyone loves a good little lift. And it's not to be confused with a Spock brow where you look like this.
Yeah.
You know, like really, really intense like that. It's just a little lift right here. When you get a Spock brow, that's a result from a misinjection. And God forbid that happens to you or anybody, it can always be fixed, you know, because that's kind of intense. Another area people do for Botox that is not anti-wrinkle, but people are obsessed with, is called a Botox lip flip. It's really cheesy with your teeth. When the upper lip curls and tucks under when you smile and it disappears, people like to do just 4 units above the cupid's bow. Rotates the lip out, super cute. Never had anyone that didn't like lip flip. Just want to let you know all your options. The other thing people do with Botox that is my personal favorite is a Botox massive reduction. Out of all the cosmetic injections I've done to my face, including plastic surgery, hands down this is my favorite because it just slims the face and it's very gradual. So you put in your tree muscle, the Botox here, over time everything starts looking more snatched. It's really pretty. Bite down really hard for me. And left. And bite down hard again. Yeah, you can it because you're strong just like me. That's always an option too. So you know everything that you can do with Botox.
How many units do you think that would?
I think you're just a 20 uniter. I'm 30.
On each side, or?
Based on your muscle strength. Yeah, and I'll put that on there because sometimes people don't like that fullness, especially when you smile. It kind of puffs out more. That's why I love it so much. Switch gears and filler really quick. If under eyes are something that you're starting to see a little hollowing, if you want to look for things, just know you are a good candidate for under eye filler for a little refreshment. If you wanted to, if it bothers you, if it doesn't, don't worry about it. And lastly, smile lines. You're gonna notice with Botox, you literally become lineless on your upper face, and the lines that still persist are the smile lines. Little filler here to soften would be so pretty on you. Just to let you know what you have, but let's focus, like I said, on Botox. I'll put a treatment plan for future if you're ever interested in filler, and then we'll go from there.
Awesome. Would I be able to not do the bunny lines right here?
I didn't really see that in you when you're smiling, that's why I didn't talk about it, but yeah, I don't think you need it.
Okay. I like the 11s and right here, and then
The massive reduction, yeah. And then no for the lip flip.
yeah, I don't
Yeah.
think I want to.
No worries.
So how many units do you think it would be total?
I'll add it up because I'm really bad at simple math and on the spot. It's like embarrassing. So Yasmin will convert that into cost, and then she'll go over all the areas. You do whatever you feel comfortable. You don't have to do anything at all. So, all right, of course.
Thank you so much.
Of course, I'll be back with her and we'll get started. Okay, love? Okay, so for my last patient, I like to typically sit down, write down all the units I recommended. So this is my little cheat sheet that us injectors use here at Beauty Boost, and we just kind of go through all the areas we recommended. So we always start our patients out with Botox. Yes, there's Dysport, but this is typically the gold standard of neurotoxins. I didn't recommend any in her forehead lines in Site A. I did recommend 30 units in her frown lines, and I did recommend 8 units around each eye, and that will help open up her eyes and give her brow lift. It doesn't sound like she was interested in lip flips, so we're going to skip that, but she had some interest in her masseters. We're going to add these 2 units up together for her upper face, which is 46, and then we are going to quote her on masseter reduction. So I usually give this slip now to my helpful medical assistant, Yasmin, and and she will pull this up on an iPad, provide the quote with the patient. If she's happy with and okay with the pricing, then we'll get started. Started excited. So here's the poster instructions for Botox.
Okay.
Go ahead and review it. Let me know if you have any questions. It's for you to keep.
I was wondering, so I typically use like a gua sha.
Mm-hmm.
How long do I have to wait before I can start using that again?
So only 4 hours. I want you to not like move the area, like no rubbing your eyes or like washing your face. It's 12:15 now, so at 4:15 you can use your gua sha.
Okay,
Yeah.
so like tomorrow's totally safe.
Totally fine.
Okay.
Same with working out.
Awesome.
4 hours. And a couple things I want you to pay attention to for timelines.
Okay.
2 weeks for it to kick in, and it only lasts 3 months.
Okay.
So just keep that in mind. You're not going to see anything today, not tomorrow, not the next day. Just got to be patient. I want to see you back in 2 weeks for a quick follow-up. Make sure you're comfortable and you're happy with the results.
Okay.
If you have to do additional units, you could just do it then. So how'd you hear about us?
TikTok.
Oh,
Like
nice!
a majority of people have found you through TikTok. It's pretty great.
I'm just marking up. I'm not doing anything at all yet. You're all done.
Oh my god. Thank you so much.
So one of the projects I'm working on as a med spa owner is renovating our office. So our office needed a little office boost. So let me show you what I've done and what I'm planning on doing. Take a look at this little waiting area. It's not very large, I know, but I did replace the chairs and I'm really excited because they're tufted. I think they're very glam and very comfortable. And given with COVID, I thought this was more friendly than a couch, so you're not sitting next to someone. Over here, we went ahead and repainted the surface of the front desk, which I'm absolutely in love with. Our theme here is pinks, golds, and whites. So I really like how that came together. I love the Calcutta marble top. This just makes it very polished, very sleek, very professional, and I think medical and clean. Our sign needs a little sign boost, if you will. We are going to be moving the foam. It's made out of foam basically, but I think the LED lit makes it so much more vibrant and classy and professional. So that's coming in from Etsy. I'll show you guys once we get it in. And then if you look over ahead, we just installed these cute little mini chandeliers, which I'm obsessed with. It doesn't have all the chandelier lights in. I'm getting that from Amazon. That will be completed very soon. So we did just install these shelves, which I'm absolutely obsessed with, especially the light. It just showcased our skincare inventory a lot better. We are obsessed with ZO, and recently we acquired Skin Better and Skin Suitable. So this just is a reminder for patients that if they're not started on skincare, it's a really good time to start or refill your products. My idea to make it a little less white is to put a little bit of wallpaper on a backsplash. I think that will give it a nice pop of color and maybe introduce some greenery, which I can't wait to go to Home Goods to find. I love that we got some gold accents on the cabinetry here. I think the hints of gold is just very modern and very sleek, and it just ties in our whole theme. But let's come on over here. We also did add crown molding to the edges, just again for a more sleek look. We are going to be adding some crown molding here just to cover up some of the cracks in the ceiling that the previous tenant had. So I think that will look a lot better in terms of our ceiling. If you follow me down here, I think I'm trying to figure out how to make this a little less white and hospital-like, so I'm thinking I might paint the frame of the bathroom. So let me know if you guys think I should do that or not, just to break it up. Then when it comes to our kitchenette, it's really cute, but again, I think it needs a little bit of color, so I'm either going to be doing gold tile as a backsplash or wallpaper. Whatever's more affordable, just because I don't think this is our forever home, but just something temporarily that will make it a really cute and fun area to look at. I'm thinking I'm going to be replacing the silver sink with a white ceramic sink, and I have a beautiful gold faucet that came in from Amazon to install in this area as well. That's it for right now in terms of my office boost renovations. If you guys see something that I didn't see, please let me know in the comments. I'm always open to suggestions. My next patient is doing PRF under eye injections and a microneedling treatment with PRP, so come on in, let's get started. We're going to start with the PRF under eye injections that help with brightening. So we already drew her blood. We put it in our centrifuge. It spins it, and after a certain amount of time, her blood products slowly separate based on molecular weight. So we will see the white blood cells on the top, red blood cells on the bottom, We're more interested in the white blood cells because that is what's robust in our growth factors. This one, the way that this is obtained, the PRF, is just at a lower speed. It forms a fibrin clot, which is perfect for injections. When we inject it underneath her eye, over the next 3 weeks, it's gonna be slowly releasing growth factors underneath her eye, and it's gonna help thicken up the skin underneath here so you don't see as much darkness or crepiness. So I'm just creating a little pilot hole, and this is exactly where my cannula will go. Cannula glides underneath the tissue, although it looks like a long needle, it's not. Pretty comfortable for the patient, and that's really it. And now we're ready to inject the PRF. So she's gonna expect some under eye swelling for just 2 days. But like I said, over 3 weeks is what we're most interested in. At the day 28 mark is when we start to produce the collagen, and that's a good time to do one more treatment. We always recommend a series of at least 3 to 5 for best results. For her in particular, I think she'll get away with 3. Doing okay? Yeah. And that's it. So pretty much your own growth factors, also known as stem cells. Very well tolerated. Her PRP is done spinning as expected. The red blood cells are at the bottom, white on top. So I'm just gonna go ahead and extract the white ones. And this is where we get all the good stuff. Typically when we see nice clear fluid, just means that the patient is nice and hydrated, which we always want before treatment to yield more plasma. If it's cloudy and not enough, it's usually a sign that they're dehydrated or don't have the best health. Sometimes we could see little cholesterol plaques in here too. And now this will serve as my glide for the microneedling. So let's do this. The numbing cream from her face. I like to work in sections when it comes to this, only because it allows the other areas that we are not treating to numb a little bit longer. I noticed that by the time I get to the last area, which is typically the forehead, the numbing wore off and it's a little more sensitive for the patient. Section's the way to go. I'm going disinfecting her face now with an alcohol wipe. The reason why we do microneedling facials here at Beauty Boost is a combination of 3 reasons. So number 1 is of course anti-aging. We get that beautiful collagen stimulation in terms of helping the skin tighten up a little bit. Number 2 is resurfacing. So sometimes we have these deep congested areas known as like little comedones throughout the face that help release with the little tiny microneedles. And number 3, it helps shrink down pores and even helps clear out these blackheads. So I actually love it for all 3 reasons. I personally do it every 3 months with my Botox. People do the same thing and then thereafter once a year to maintain the results. Inject the PRF underneath the eyes. I still like to microneedle over it because I really believe that we can approach the under eye inferior to the skin and superior. That way both routes really help attack the skin in terms of rejuvenation. A lot of us do have congestion around the mouth due to wearing masks, so another reason why this treatment is amazing, just to release all that really indurated texture. You simply can't get rid of skincare or extractions because of the scars it leaves. So the redness is coming from, of course, the microneedles. To show you what that looks like, at the tip of this head, there's 13 tiny microneedles that penetrate in and out to a certain level of depth that I actually program it to. So for her, she's on the high of 2.0 millimeters of depth, which is exactly where I want her to be. She has some puncti bleeding, which is as expected. This is our clinical endpoint to make sure she's gonna get great results. I did go over the area 3 to 5 times. This was trademarked as a vampire facial that Kim Kardashian made famous because of all the plasma that sits on your face. But the more red, the more bloody she gets does not mean that she has a more or less effective treatment. So just keep that in mind if you ladies get it wherever you guys are located. So you notice me apply the PRP on the face before I microneedle. That serves as a glide, meaning it helps my microneedling pen glide along her skin. And then you'll see me apply it after the microneedling because once we make these little tiny holes in the skin with the needle, it kind of acts like a channel for the PRP to be absorbed at a deeper level of the skin. So a lot of our patients assistants do add on neck. Again, it helps with skin tightening, but take a look at her horizontal neck lines. When they're deep like that, microneedling really helps just break up that contracted band that's denting in the skin. I also like to inject PRF into this area too. Did do it for her under eyes today, but maybe next time we'll do her necklines. I am loving what this will do for her. My next patient is doing a smiling boost. Done her smiling boost before in the past. I want to say within the past year, maybe a little over. And so we're just ready for a little bit more. She's starting to see a little shadows by her nose. So we're going to just touch up that area along with her corners of her mouth. And it's a really pretty correction when it's done correctly. Unfortunately, I see this area overfilled in Orange County. And it starts to make people, I always say this, look like a monkey because it looks just too full, unnatural. A little shadow is nice and normal and natural. However, it doesn't have to be as deep. So let's do this. This is an area I always notice on patients who do upper face Botox, and I always tell them that, you know, this is an area where shadows and lines still exist, so you always want to make sure that your upper face matches the lower face. So if these are two areas that you're persistently having wrinkles, definitely treat them with your Botox because you want to make sure that you're nice and even throughout. You doing okay? Mm-hmm. We're working on the oral commissure. We are noticing it drag down a little bit. So what I like to do is put a little bit of product in the corners. It helps to support the corner of the lip from dragging down, and that usually is a result from just overall fat pad, just descent and laxity of the skin, just contributing to the structures, giving you this little heaviness down here. Okay, producers, thank you so much for following me around for today. If you guys like these videos, please let me know. I'm happy to put out plenty of content just like this. Like, comment, and subscribe, and I'll see you next time. So we already drew her blood. We usually put in this of course we do. One more, here we go. So like, comment, and subscribe.